Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'm going to talk about individual preparation and a conversation that every person needs to have during this period of time. The first thing that I'd like to talk about is individual preparation. Every person at this time needs to prepare for potentially being hospitalized. I know that's really scary to think about, but you could be the small percentage of people that needs to be hospitalized for symptoms of COVID-19. And there needs to be a little bit of preparation that should be done before that. It would be so helpful for you to have documentation that would help ease your admission to the hospital. Because remember, your family members and friends will not be able to accompany you inside the hospital. So it's important for you to have documentation about your medical history. There are some very important things that need to be on this medical history, including your name, date of birth, your primary care physician, all medication that you're taking, including the dosages, and anything over the counter that you're taking. You should also include past medical history, any allergies to medication, and your social history, such as tobacco use, whether you drink alcohol, or whether you use recreational drugs. We're not asking these things to pry. We're asking these things because they could potentially affect the way that we treat you in the hospital. If you're a heavy smoker, we'd like to put a nicotine patch on you. If you drink heavily, we need to look for alcohol withdrawal, which is a very serious condition. And if you use recreational drugs, you may not respond to pain medications the way someone who doesn't use recreational drugs would. You also should list any emergency contacts. Like I said, you'll be going into the hospital alone. No one will be able to be there with you, and you may not be able to talk easily because of your shortness of breath. So it's important for you to have this sheet of paper or document with all of this information on it. It would be very, very helpful for all physicians caring for you. A way to get a form to fill out is to go to aarp.org and type in personal medication record. There's a great form that you can fill out online and print out and either put in your wallet or put somewhere in your home where other members know about it. The next difficult conversation that I'd like everyone to have before the emergency arises is regarding advance directives. Once again, I know this is very difficult to think about, but I don't want you to be scrambling when you're in the midst of a crisis, feeling very short of breath and very uncomfortable to have this type of conversation with someone in your family. Once again, for information about this, you can go to aarp.org and look for advance directive forms by each state. Each state is very variable in what they call the forms and what is required for each of these forms. Let me just explain a little bit about the forms, but I'm not going to go into a lot of detail because it is kind of overwhelming. I think the most important thing for everyone right now is to establish a medical power of attorney. This can also be called a healthcare proxy or a healthcare agent, depending on the state that you live in. This is a legal document that gives one person the ability to make healthcare decisions if you're not able to. It only lasts as long as you're incapacitated. Once you recover, they don't have that same authority or decision making. It will automatically be your spouse unless you designate someone else. So if you're married and you're comfortable that your spouse is your medical power of attorney, you don't need to fill out any extra paperwork. However, if you're not married, if you're separated, if you're divorced, then it is important for you to designate one person who can be that spokesperson for you. Remember that this person will speak for you. They have full access to your medical records, and they have full authority to make choices about tests, surgery, and medication. So it's important for you to have a conversation with that person about what your wishes might be if things were not to go well. Decisions such as end-of-life care, intubation, being placed on a breathing machine, receiving artificial nutrition, things like that. If you're older and you have multiple children, it's important to choose one child. I know that's very difficult, but it's so much easier to designate one child than to have discord amongst several children during this difficult time. You can choose a second and third alternative, especially if you are unsure whether your number one choice is going to be able to take on this responsibility. Some other advanced directives include a living will, which also can be called a healthcare declaration. That's a document that specifies end-of-life care instructions. You can get very specific about what you do and don't want to do, but I just want people to be careful. I think if you designate someone to be your power of attorney that you really trust, you need to give them the ability to make those decisions for you. And you just give them broad generalizations about what you would and wouldn't like if things were not going well. There's also a form called a POST or POST or MOST. MOST stands for Medical Orders for Scope of Treatment. This is usually for the very, very frail and is a document that helps physicians plan for care at the end of someone's life. At the end of the day, I think the most important thing is to designate a medical power of attorney. If you are married, your spouse will automatically be your medical power of attorney. If you're comfortable with that, no paperwork needs to be filled out. However, if you're single, separated, or divorced, it is important to designate a medical power of attorney because, as I mentioned, you won't have that person by your bedside. They'll have to be called during your hospitalization, and it's important for you to have had conversations with them before the need arises. At the end of the day, I want to continue to remind everyone to wash their hands and keep social distancing. Thanks again for joining me.